Dyspareunia. Dyspareunia in medical terms means
this or this alone.
Couple having to meet regularly as a means of enjoyment has become a problem. The wife, Bola, has been complaining persistent, recurrent, painful sexual intercourse, either at the beginning or at deep penetration. When any of this is happening, you need to find out what is responsible. It can be infective factor, it can be psychological, it can be physical, it can be lifestyle. So which one is your own? It is meant to be enjoyed, not to be endured. Caller, in case she's groaning and she's mourning in pain, you must be able to differentiate between mourning of enjoyment and mourning of pain. So if the mourning is like pain, you get to stop and find out what is responsible. So among other factors, I mentioned physical. Now, if there is any damage or inflammation on the vaginal wall, she will experience some pain. If you also have yeast infection, you can have pain. And that is one of the commonest things that people do not understand. Then number 3, it can be psychological. In case of rape or case of forceful event, she was going to have a lot of pain. Outside this, the aspect of foreplay make it more interesting. The woman needs to get to a stage whereby the vaginal wall is supposed to secrete those fluids that will water or secrete lubrication for that part, so that when you start the process, it is not painful. Like I said, sexual intercourse is to be enjoyed, not to be endured. It can be psychological, like I said. You don't like the person, or it is not willingly, then the pain comes in. So to diagnose, you need to go back to what is the cause. In case you're having PID, infection, you're having pain, discharges from time to time, the discharge is colorful, is yellowish, or it's like a powder that's soaked in water, or a bread that's soaked in water, and then you feel it's like powder. That tells you they're having a yeast infection, or the odor that's coming out appears to be like a fish that is spoiled. That tells you that you have infection. Or the color is becoming greenish, or it's becoming yellowish. That tells you that there's infection. If you do any sexual activity at that time, you are likely to have pain. So why don't you go see doctor, get tested and get treated, then you are free from pain and you will enjoy it as it's supposed to be. So it is not the fault of the man also if you don't tell him how you feel. Sometimes there is a swelling or an inflammation on the wall. Each time this person is about to go in, there is pain or it goes in with force. So you get to abandon the process and you don't look forward to it. So it's something you must look forward to all the time if only you enjoy it. So for couples that are looking for a baby, you must sit together and resolve this problem. See doctor together, and you might need counseling. Sometimes you need the CBT, cognitive behavioral therapy, to tell you how to go about it. Not because you are not good in doing it, but somebody needs to teach you how it is done so as to get you the result you want. On a final note, when a couple begins to experience things like this, it is not witchcraft and it's not that somebody is after you. Call her, calm down, and then realize what she needs. Most of the time, African men are not patient enough. Be patient. All the foreplay that's required to be done before she gets to the plateau must be done. Otherwise, you end up not enjoying it, and she will not enjoy it and not look forward to it. And you want to have a baby or you want to enjoy it with her, get to do the right thing at the appropriate place. So all the sport of touch that is required to get her on must be done so as she gets wet to that point of easy penetration. So like we said, dyspareunia can be superficial, can be at the entrance, can be at deep penetration, can be after. You can imagine the process has been done, no pain, but immediately you are done, the man is in pain. If she put water or anything to clean up, she will smear pepper. And such a woman are not likely to look forward to such episode again. Until another time, Look for all the means to enjoy it together and not to make one suffer.